we're talking about an existing crisis, especially on the African continent, in light of a global crisis that has been brought about by COVID-19. And one of the critical issues, even as we continue in our engagement, and I really liked what you said there, Bill, is that even as we face current challenges, it shouldn't be at the expense of pulling back on the progress that we have made in other areas such as malaria and polio. We have made tremendous progress over the years. But more and more, and I'm not just talking about Kenya, I'm talking about all African countries, we are facing increased constraint, especially with regard to resources that we can deploy to existing problems because of new issues that are coming up. COVID-19 has had a huge impact in terms of where we've needed to focus government resources, and in some cases at the expense of ongoing programs that have been having success. We need to be able to ask ourselves. The last thing that we have also seen as we have worked through our various stimulus programs during this particular COVID period is how can we also bring in our youth, our young people, and make them part and parcel of our engagements in dealing with these issues. Instead of seeing them as a problem, I believe they can be a great asset, not only in terms of our field outreach, but also in terms of this being a way and a process for them to also earn a living. And this we have seen, like I said, through various interventions that we've had during our lockdown, and we have used different instruments to engage our young people. And we have seen these bearing fruit. So how can we also use this huge wealth of young, energetic young people to assist us in this fight in combating malaria? COVID has also brought about a much greater participation of our private sectors. Our private sectors have also been heavily involved in working together with governments to see how that they could assist and participate in our COVID response situations. Again, we need to see how we can, on both a national, regional, and continent-wide basis, again be able to pool private sector resources to work together with government, to work together with our international partners, to be able to deal with this particular situation. So, in general terms, I want to appreciate the great work that this council has done over the years. I want to say that we don't want to lose or put our eye off the ball at this particular moment, given the other global challenges that are there. I want to say that I believe that we can do a lot more by getting, especially the African continent, to pool resources and to work together in the fight against malaria and existing issues like polio and so forth, to better manage the resources that we have by we have also had some benefits that have come out from this COVID experience. By pooling together as a continent to fight the COVID-19 situation, we have found that we are much better able to deal with the scenario through both sharing and greater sharing of both information, but also of pooling of resources to enable us to purchase materials in a much more economically favorable manner. And I think this is something that we've learned from COVID that I think we can translate into our malaria agenda. I think the third thing is the need for us to be able, through the use of digitization, to be able to be better informed. And that I say because as we've been tackling COVID, we were tackling something that we were not aware of. And we have found that through the use of different applications, we were actually able to manage this COVID process better? How can we use the digital process to help bring greater information, greater knowledge?
Africa, most states at the lower level, they are the ones in charge of the community health workers. And but going forward in terms of financing, I think we need to really get the private sector very, very much involved. Like what you are saying in Nigeria, when you look at what happened with this COVID, almost every single government, both the federal government and the state governments, they have increased tremendously their health budget. Whereas before it was really a tug of war, even trying to get money for health. But right now, I think it has helped, and I think raising financing in most African countries now. When you talk about health, people are now more serious. They are now more careful, looking at look, we need to spend a lot of money in health.
Keep the conversation going. Now we have a convenient way to buy Airtel airtime using Safaricom number through M-Pesa, as following the steps. 1. Go to your M-Pesa menu. 2. Select Lipa na M-Pesa option. 3. Select Paybill option and enter 1566215 as paybill number. 4. Enter account name as your phone number. And lastly, enter the amount you desire to recharge. Then your M-Pesa PIN and hit OK. With those few steps, you're good to go.